Hi, my name's Sara Randall and I'm a midwife and an osteopath. And the first piece of information I'd like to give you today is to write a really nice detailed birth plan. Every midwife will tell you to write a birth plan, but it's actually what you put on that birth plan that makes the difference. It's an opportunity for you to write down all of your thoughts and wishes that you might want to be acknowledged through the birth process. It's not a contract for you to write down how things must be laid out, but it's just an idea where you can express your feelings and what you'd like to achieve from your birth. The second piece of information I'd like to share with you today is that knowledge is power. So please go and read research, books, journals, blogs, as much as you can so that you feel in control of what's going to happen through the birth process and the postnatal time. A lot of women focus on labour and are scared of labour, and it's trying to really take away that fear element so that you're going in with your eyes open and aware that you are in control of yourself and you've read and are aware of what may happen and the opportunities that are there for you, the choices that are there for you. I think a lot of women that you talk to only have negative stories to tell you, and I think that you have to use those stories to build a positive experience for yourself. It doesn't mean that you're going to have a negative experience because it appears that everybody else has. So if you've done your reading and you're in control, then the birth experience is yours in the making. The third thing I'd like to share with you today is about taking care of yourself. When you're pregnant and have had a baby, a lot of attention is paid to the newborn baby and the labour process, and women often forget about looking after number one. It's always a good idea to go and see an osteopath like myself for a 6-week check after delivery, because that enables them to look at your body and all its changes from being pregnant, and just to make sure that you are healing back into your pre-pregnancy state and that your spine and pelvis are sitting in a good alignment. Especially if you've got pubic symphysis dysfunction. I've found a lot of ladies who go on to have subsequent pregnancies who haven't had a treatment postnatally may go on to have SPD again in the future. But ladies that have actually had the treatment find that the likelihood of SPD is actually a lot less. So go and have a follow-up with an osteopath like myself.